Arkansas confirms first measles cases since 2018. Two unvaccinated children spark exposure alerts across central Arkansas as the health department races now to contain the highly contagious virus. That's where we begin tonight as we are learning more about the two measles cases that the Arkansas Department of Health confirmed yesterday. 5 News reporter Jacob Luthi spoke with the Arkansas Department of Health and a local doctor to find out what residents can do to stay safe. Jacob?
Yeah, Darren, these infections are the first confirmed cases of measles in Arkansas since 2018. And while the two patients are from central Arkansas, I'm told this is one of the most infectious diseases out there. And tonight, health officials in the state are working to track down anyone else who may have been exposed.
We're trying to raise awareness of the possibility of seeing more measles in the state.
The Arkansas Department of Health is working to identify people who may have been exposed to measles after two unvaccinated patients from Saline and Faulkner counties contracted the disease while traveling out of state.
We have been collaborating with those clinics to get a list of all the people who were there, and those healthcare facilities are following up and contacting those people, and then we are then following up with them to let them know about what they can do.
ADH did not specify where the patients traveled to. The department says the patients are under the age of 18 and that other patients could have been exposed when the infected children were taken to hospitals and clinics in central Arkansas. Dr. Jennifer Dillahay with ADH says measles is one of the most infectious diseases, with symptoms including cough, runny nose, watery and red eyes, and a rash.
If a person has a rash, we want to make sure they call ahead to their doctor and let them know, because if they go into the clinic and then they will expose everyone there. If someone comes into a room and there are people in the room that haven't been vaccinated or they haven't had measles before, then there's a 90% chance that they will be infected.
Springdale pediatrician Dr. Susan Averett says her office has already been getting calls from parents double-checking their child's vaccination status and asking if they could get a vaccination early. She's also already working on a plan to deal with the disease as a healthcare provider.
We're not considered to be in an area with an outbreak because we've only had those two cases, but we probably feel like it's just a matter of time. We have developed a triage protocol for our clinic so that when people call with certain symptoms, we ask certain questions.
Averett says she encourages anyone who has not yet to get vaccinated.
It is a worse respiratory virus than most and a higher incidence of requiring hospitalizations than our typical respiratory virus. So many people are very sick and need supportive care. Anyone who has never had measles and has never been vaccinated or has not completed their vaccine series should get vaccinated right away.
Now, Averett says her clinic usually gives the vaccine to babies once at the 12-month mark and again between the 4- and 6-year-old mark. For adults, ADH says anyone born before 1957 is presumed to be immune because of how prevalent measles was during that time, but says anyone can get the vaccine if they haven't already and should speak with their healthcare provider for additional information.
All right, so Jacob, if I think I have it or my child or grandchild may have been exposed to this, what's next?
Yeah, so ADH released a list of exposure locations on their website. We have it as well on 5newsonline.com, but there's also a number that you can call. People who may have been exposed can call. It's 1-866-940-7568.
All right, Jacob, thanks. Appreciate that.